Hi, my name's Dr. Paula Sauer. I am a physical therapist, and I've created this sequence for anyone who just got over the flu, a lung infection, or had COVID, or is just really run down and tired, teetering on burnout. This is a short breath work practice with a few very easy exercises. It's not meant to be vigorous. And by all means, if you can't keep up with the cueing on the breath, go back to your normal breath and just join the cueing when you can. And feel free to do this practice multiple times in one day so that you feel like you're starting to do things again. I would encourage you also to go for a walk, short walks, do them multiple times per day, especially if you've been in bed for many days in a row and you're severely deconditioned from whatever infection you're getting over, or if you're just fighting burnout. So let's begin with the breath, and let's begin with a little bit of rib expansion here. If you have a TheraBand, this would be helpful. So you'll grab your TheraBand. If you don't, you can just rest your hands on your ribs. I'm going to show both. But if you have a TheraBand, you can wrap it around the lower part of your ribs. And you want it to be flat against your ribs, almost like you're wrapping a belt around. And you're going to cross that in the front and then pull on it a little bit so you get a little input. Drop your shoulders down and find a comfortable seated position. So if you're sitting on the ground, fine, but if you can sit in a chair. You can also sit on your couch, whatever is comfortable for you. And then I want you to really connect right now just with sending the inhalation a little further down. When we're sick, our breath tends to stay a little bit higher and we're just trying to grasp for air. If you have asthma, which I do, I know that air can be really hard to get further down and then out. It can feel hard to get it out. So do the best that you can and practice, and just at any point in time you feel like you can't keep up with the breath cues, don't worry about that. Just breathe your normal breath and then re-enter the process. So there's no right or wrong here, just try. And then eventually your breath will get a little more stabilized and you'll get a little more control. Okay, here we go. Drop the shoulders down, pull on that TheraBand a little bit, and then take an inhale through your nose. And then exhale. Inhale. Let the ribs push out into the TheraBand as you're doing that inhalation. Exhale. Inhale. If you have a hard time breathing through your nose because you're congested, take it through the mouth, but kind of like you're sucking the air through a straw so you get a little resistance. Exhale. Same thing, you can take it through the nose or through the mouth. There's no right or wrong here. We're just trying to get the ribs to expand and that you can experience the breath going deeper. Inhale. Exhale. I'm going to show without the TheraBand so you can see that. You'll take your hands on the ribs. Inhale. You can see my ribs moving out to the side. Exhale. You can even push on the ribs a little bit. Inhale. And exhale. Inhale. See if you can deepen that breath a little bit more. And exhale. One more breath for me like that. Inhale. And exhale. Now this video, I'm not going to go over like belly, pelvic floor connection here, really focusing more on the breath and getting rib expansion and the body moving a little bit. Those videos will come later. We're coming onto our hands and our knees here. So this is a version of cat-cow. There's many ways to do this. This version, our inhalation is going to be in this position, this round position. It's really to get the expansion of the back body and the side body with the inhalation. That's our intention with this particular exercise for this case. Exhale, you're going to come into extension. Sometimes this is taught the opposite way. And it's all about what your goal and your intention is. There's no right or wrong here. It's what are we looking for? I want to expand the ribs. So inhale, get a big round back. Exhale. Expand the chest as you come into that exhale. Get length through the spine. Inhale, round the pelvis under. Round the mid and low back, head comes under, and exhale. Go as slow or fast as you want, even play with a full breath cycle in one position. So this time we're gonna inhale here, pause here, and then exhale, stay here. Inhale. Now exhale, change the position, come into an extended position. Pause here, inhale. Exhale. One more cycle, inhale, full rounded back. Exhale. Good, pause. Now take your right hand, thread it underneath your left. Your head and your shoulder are gonna hit the ground. It's gonna look like this. You're gonna stay in this rotation and breathe here. Inhale. The ribs on the side here are gonna expand outward. Exhale. Inhale. And exhale. Inhale. And exhale. One more, see if you can sip in more breath. Inhale. Sip in more. And exhale. Good. Come back. We're going to do the other side. You're going to see me from this side. Rotate. Now, you can keep your arm here or you can go here. I like to be here. For some of you at home, maybe this is more accessible. Play with that for yourself. Inhale. You're looking for an expansion of the rib on this side now. So on the opposite side. Exhale. If you can't come into this rotation, you can always place a pillow under your head. Inhale. And exhale. Again, there's no need that you have to have the breath through your nose or your mouth. It's whatever you can. You're getting over being sick. Inhale. And exhale. One more breath. Inhale. And exhale. Good. Now, come onto your side. Your knees are bent, your arms are forward. If you need a pillow here under your head, grab it. I'm just gonna grab a red pillow so you can see the contrast here. Lie with your arms flat and straight in front of you. Your knees are bent. When you inhale, your gaze is gonna follow your top arm. You're gonna inhale and rotate back. Exhale. Come back. There's no right or wrong here. Inhale. If you can't go all the way back, that's fine. Exhale. Inhale. And exhale. One more time. Inhale. And exhale. Great, let's do the other side. I'm gonna set it up here so you can see me. For you at home, just flip over to the other side. You really don't need to see me. We're doing the same exercise that we did before, just on the other side. Arms forward in front of you. Inhale. And exhale. There's gonna be one side that you can rotate more towards. Doesn't mean anything, don't judge it. Just go, okay, that's interesting. Inhale. and exhale. 2 more breaths. Inhale. The gaze follows the hand. Exhale. Last breath. Inhale. And exhale. We're going to do one more exercise here. Come on to your hands and knees again. This time I want you to think of your elbow coming all the way to the other elbow. So you're rotating a little bit, and then you're going to rotate back. Okay, this part's going to be your inhalation. It's going to feel really awkward and stiff. You can see I don't have a lot of rotation there. That's okay. This is a really good exercise for me. So if you're feeling at home like you're stuck or blocked, good. We're going to work into that boundary. There's nothing wrong with that. And you're going to feel one side is going to move differently than the other. Totally normal. Okay, so this is your exhale. So we're going to go inhale, rotate back. Exhale, rotate forward. Inhale. And exhale. Inhale. And exhale. Last one. Inhale. And exhale. Okay, let's go to the other side. I'm just going to flip around this way. Hold your head, elbow to elbow. Inhale. And then exhale, come back down. Inhale, rotate, take your gaze to your elbow. Exhale, come back. Inhale. And exhale. Last one, inhale. And then exhale. Very good. Come back onto your hands and knees. Push yourself back into child's pose. Take a few breaths there. If you need a pillow for your head, go ahead and place that down on your mat. You'll rest your head on the pillow and just breathe into the back body. Take a few breaths on your own. And then walk your hands over to one side. Sink back more. You're going to get a stretch into the side body. It's going to feel really yummy and good. Stay there. And then let's go walk our hands to the other side. Get a stretch into the side body, hang out. We're just doing 3 to 4 breaths here. Each pose has about 3 to 4 breaths. And then come back up onto your hands and knees. Sit back. And that's it. Okay. Feel free to repeat this practice as often as you want. I find that when you're sick, doing a simple breath practice like this can really help kind of re-energize you and really feel more of your body instead of staying into the upper part of your lungs here. If you know anybody who needs this because they're recovering over something, send this, share this. Thank you so much for watching. I'll have more videos coming soon. Please comment below if there's something you'd like to see or if you have any questions or comments about this sequence. Okay, thanks for watching.